Hello and welcome to our course, Calling All First Responders, Real-Time Continuous Glucose Monitoring Awareness and Diabetes Emergencies. We know that first responders care for many people experiencing a diabetes-related emergency. So our goal with this program is to help you understand the challenges of living with diabetes and better understand the reasons behind why these emergency situations occur. We also want to introduce you to Dexcom in real-time continuous glucose monitoring, or a real-time CGM, so you can understand how this technology might help people with diabetes to prevent some of these emergency situations. With this new information, if you do encounter a person currently using RT CGM, we hope you will have a better understanding of how the technology can improve diabetes outcomes. The title of this module is Stigma in Diabetes. Let's take a moment to watch this short video and try to put yourself in the shoes of someone living with diabetes.
You don't look like a diabetic. What did you do to get that?
Have you been drinking? You can't have that.
Do you need to do that here?
Well, the comments you hear in that video are real, and they have huge impact. You don't look like a diabetic. What did you do to get that? These conversations happen and lead to judgment, shame, blame, and stigma. Stigma is widely prevalent, with 76% of type 1 diabetes and 52% of people with type 2 diabetes reporting experiencing diabetes stigma. When people feel stigmatized, they may not seek the care they need to stay healthy, and this can lead to poor health outcomes. We know that language we use when talking about diabetes can lead to stigma or can add to stigma. As healthcare professionals, understanding the challenging nature of these chronic conditions will help convey support and empathy when caring for people experiencing a diabetes emergency. It can also help promote supportive interactions with family members possibly experiencing feelings of distress and discouragement. Deb is now going to share some more information about why language matters.
Thanks, Fran. You know, when we talk about the language we use in healthcare, it's more than just the words we use. It's actually our way of thinking. So it's communication in all aspects, including body language and physical expressions. But it's also, and I think most importantly, the thinking and the mental processing that's going on during a conversation. So that's why changing your thinking is the first step. And it's also why it takes time, education, and practice. And that's why we've included it in this series. So what if these were the messages you heard when living with diabetes? Your A1C is very bad. You should do what we tell you to do. She's been non-compliant with her meds. Your diabetes is uncontrolled. Well, you're a diabetic. You can't eat that. Have you been cheating? Or he calls 911 all the time. If you heard these messages, you wouldn't want to go to your medical appointments. You wouldn't want to get your labs done. You'd feel judged, right? Like you were maybe a bad child. And this is how many people living with a chronic condition like diabetes feel. And so often they live in the closet and they don't share and they don't get support because they don't know how they will be perceived. So acknowledging the impact that language can have can really help you understand some of the barriers people face, both real and perceived. And because many people don't understand the genetic nature of diabetes, there are many myths and misconceptions and even jokes that exist that perpetuate this misinformation. So when people live with a chronic condition that's associated with the need to change behaviors and lifestyle, their sense of identity can get disrupted. And when we start applying labels to individuals, then that's what can lead to stigma and bias. So labels such as uncontrolled or non-compliant or non-adherent are stigmatizing terms associated with being lazy or unmotivated or that they don't care. And we know that's not true. So in order to move forward with language, we need to bust those myths and correct the misconceptions. They exist today everywhere, in hospitals, in doctor's offices, and even with diabetes care teams or first responders or with family and friends. So each time we hear a misconception, it's an opportunity for education. And until we change these thought patterns, living with diabetes is going to remain a challenge. So changing the language is just one piece of the puzzle, but it's a place to start. And if we speak in these terms, we can then help change the narrative. So our goal is using person-first, strength-based language. So what does that mean? So we want to use language that is neutral, non-judgmental, and based on facts, actions, or physiology and biology, right? Words that are free from stigma. So it is a strengths-based approach that's very respectful and inclusive and imparts hope. And our goal is to foster collaboration and be very person-centered. So one simple example would be using a person living with diabetes instead of using diabetic. That's putting the person first. So language is pervasive, it's everywhere. So the goal is to use this language everywhere, right? Not just with the person with diabetes and their families, but when you communicate with your other first responders, when you're in emergency departments and speaking with the care team. Again, the goal is to change our thinking. Now, would you feel differently if these were the messages and conversations you had? You're working so hard to make changes. What steps can you take to spend more time in range? She's taking medicine when she can afford it. Your A1C is above your target. How can I help you? What are your favorite foods? Let's see how we can try to fit those in. How do you manage to make choices to eat healthy when you go out to dinner? And how can we help you prevent emergency situations? A colleague of mine, Jane Dickinson, has a great way to help us think about language. She says, when you change the way you think, the language will naturally follow. In our resources at the end of this website, we do have another 3-minute video that you can watch to learn how you can change the conversation in diabetes. So Fran, you know firsthand how hard it can be and how challenging diabetes can be. So can you discuss the many factors that influence glucose?
Yes, I sure can, Deb. But before I do that, I want to say, the way you relayed those supportive comments really inspired me to want to partner you as a person living with diabetes. I could totally appreciate the difference in those first comments that you made. And then the second, the tone of voice, the way your empathy just came out in your voice so strongly. It was really such an important topic. So thank you. Feeling understood is such an important aspect of having a person with diabetes feel like they are part of their diabetes healthcare team. Being understood takes away stress and creates the engagement necessary to promote optimal health. People living with diabetes make countless diabetes-related decisions daily. Factors they consider are for the most part measurable and tangible, such as grams of carbohydrates to be consumed or type and intensity of exercise. There are so many variables that affect glucose, such as hydration, fatigue, level of stress, heat, things that usually can't be factored into determining how much insulin to administer. These factors explain why people with diabetes can become frustrated and describe doing everything right and getting the wrong result, or doing everything the same 2 days in a row and getting different results. So this tattoo, I have seen it a few times. I am greater than my highs and lows. I think it represents, in a simple way, the enormous complexity diabetes brings to people's lives, both physically and psychologically. It also gives meaning to why some people living with diabetes just cringe when they hear the word diabetic. When working with people with diabetes, I often hear them express things like, I'm not good at this. My numbers are bad. I'm out of control. I'm afraid of going low, so I don't exercise. Often I find these people may not know anyone living with diabetes, and they don't always have the support they need from people who walk in their shoes. When people living with diabetes realize that the disorder is complex and is managed with many things that are imperfect, like imperfect insulins and technology, and they start to learn to see their numbers as information that guides decisions and not as judgments. They start to feel empowered and in control of their diabetes instead of diabetes controlling them. As you walk through these modules, think about diabetes and stigma and interactions you have had. Are there simple changes to consider to enhance your brief but important relationship with the person having a diabetes emergency and their family? We hope you enjoyed this module. Our next module reviews what real-time CGM is.